Today we're talking about how we can reduce bone stress injuries in the tactical athlete population utilizing extensive plyometrics. Why is this important? Well, running-related injuries are the #1 cause of musculoskeletal injury throughout the military as a whole and the Army in particular. One of the buckets of these running-related injuries are bone stress injuries. And bone stress injuries occur as a result of repeated mechanical overload of the bone, which causes the bone to fatigue and actually break down, causing local bone pain. Some common sites where bone stress injuries occur are in the shin, the foot, the hip, and the pelvic area. And bone stress injuries are very common in the basic training population, soldiers that are in different types of selection, and just even throughout the military as a whole due to the high demands of running and rucking. And you might ask, well, don't you think that soldiers that are doing a lot of running and rucking will have stronger bones? So bones don't actually like repetitive loads that occur in running and rucking. Bones like short, high-intensity bouts of multi-directional loads that are placed on them to actually stimulate that bone to build up and become stronger. And that's where extensive plyometrics come into play. So plyometrics are often categorized into two different buckets. We have intensive plyometrics and extensive plyometrics. Intensive plyometrics, as the name implies, are very high intensity, maximal effort. So you can think of these as repeated hurdle jumps, repeated broad jumps, or repeated vertical jumps. Like I said, they're high intensity, as the name implies, and they take the body through greater ranges of motion. Think of it as like a squat. Extensive plyometrics are submaximal effort. They're often biased to the lower leg and the foot and ankle, which is what we're looking for. And they allow us to perform higher volumes. So the easiest example of extensive plyometrics are repeat pogo jumps. So for example, these can often be programmed as 2 to 3 sets of 10 to 15 reps. And the reason why extensive plyometrics are so valuable for the lower leg is you can see that they don't take the body through full ranges of motion. They're very biased towards the lower leg, foot, and ankle, which is going to improve elasticity, speed, power, and neuromuscular control, which is exactly what we're looking for to build these soldiers to be able to tolerate the high demands of running and rucking. So we talked about in-place pogo jumps. The in-place pogo jumps are great, but that's not where we want to end. So often my beginner type exercises are those in-place pogo jumps, forward and backward line jumps, and then lateral jumps. These are extremely easy to incorporate into your strength conditioning program as they don't require any equipment. Oftentimes the best way to incorporate these is during the dynamic warm-up, prior to a run, or as like a primer prior to a lower body training session. So if we just ended there, that would be great. That would be a significant improvement to your strength conditioning program or your running program to help improve that bone stimulus, that bone building activity to try to reduce bone stress injuries moving forward. However, during like a rehab environment or when you have a personalized strength conditioning program, we can progressively overload these extensive plyometrics, making them more challenging as the soldier becomes more competent with the basics. So what we're going to do is I'm going to show you the next progression into higher level extensive plyometrics, adding more of that change of direction movement to stimulate different loading on the bone. Here are some of my favorite extensive plyometrics that incorporate change of direction movements. So ins and outs, and then we can do lateral. Then we can go into more of a sagittal plane split jumps. And like I said, in terms of sets and reps, 2 to 3 sets, 10 to 15 reps of 2 to 3 different exercises. So that'd be more of like my mid-phase exercises. Then incorporating full change of direction, so forward, lateral, and backward hops, starting on 2 leg, and then progressing into 1 leg. So the 2 leg variation, and then you can add single leg. And then the last variation is staying on a single leg the entire time. So like I said, that's my progression that I typically use with different bouts of forward, backward, and change of direction plyometrics. I'd love to hear your guys' thoughts, opinions, or any questions that you have regarding bone stress injuries, extensive plyometrics, or rehabbing from bone stress injuries. I'll put my podcast regarding bone stress injuries in the show notes, and I'll incorporate 2 to 3 of my favorite papers in regards to the pathophysiology, diagnosis, and rehab of running-related injuries. So if you like this video, go ahead and hit the like button, subscribe to my YouTube, subscribe to the podcast, and be on the lookout for more information regarding tactical strength conditioning and rehab.